of us wait until something breaks before we finally listen to our bodies. A nagging backache, a tension headache that never quite goes away, or that lingering stiffness we just chalk up to stress or aging. But what if healing wasn't just about fixing what's broken, listeners? But it's actually about understanding how the entire system works long before symptoms show up. What if real wellness came from looking at how your brain, spine, and body communicate, not just where they hurt? My guest today is someone who's doing exactly that. Listeners, meet Dr. Brian Donovan. He is a licensed chiropractor and founder of Chiropractic in Brooklyn, where he's using evidence based, neurologically informed care to create customized treatment plans that address the root causes of dysfunction, not just mask them. This whole conversation on the mindful living, listeners, isn't about quick fixes or miracle cures. It is about how science, mindfulness, and whole person care can actually help us move, feel, and live better. So let's quickly get into this interesting conversation with me, your host, Sana. So, with that, Dr. Brian, welcome to the show. And I'm really, really honored to have you here with us.
Thank you. Happy to be here.
Wonderful, wonderful. Okay, Dr. Brian, let's start right at the heart of your work. You emphasize evidence-based and neurologically informed care, and a lot of people may not associate chiropractic with science in the same way they do with other healthcare fields. So, can you explain what exactly evidence-based chiropractic care means? And why that distinction matters so much.
Yeah, sure. I'm glad that you brought that up. So I would say that this scrutiny that you're mentioning towards chiropractic care started in the early 1900s, where the AMA, American Medical Association, kind of went at war with chiropractic care. There was a lot of different court cases where chiropractic care and the founders of chiropractic actually won those court cases, but the stigma on chiropractic still remains today. And I think
Mhm.
I think if you look on Instagram and type in chiropractors or chiropractic, you'll see a lot of, I wouldn't say hate, but just kind of distrust in this chiropractic community.
Yeah. Yeah.
Yeah. So I think that stems from one, the history and stigma from the early 1900s, but also because of the earlier schools more recently that teach chiropractic. Schools like Logan, Palmer, and a few others kind of go with this more traditional sense of chiropractic, treating it more as a philosophy and as a theoretical model of how the body works. Um, they teach more about adjustments and different types of techniques. And I think a lot of the older chiropractors today still follow those models. Chiropractic is very much in its infancy, such as psychology a few years ago was more related to psychological wards or the criminally insane, but now it's gained a much more trusted level of science and medicine where pretty much psychology is now a very big field, almost bigger than chiropractic. And we're still trying to move chiropractic into that brighter limelight, but it does take time. So my school is prided on itself as an evidence-based school for chiropractic. And what that means is that we're not talking about philosophies or theories of chiropractic, but we're looking at the research on diagnostic methods and treatment methods and seeing which one of those is the best for each patient rather than focusing on beliefs or philosophies. So I think that's um, what kind of makes neurochiropractic a little bit different is that although I'm pretty young, as you could see, it's actually a good thing in this field because I don't have a polluted mind on all these theories and philosophies. My mind is focused on looking at the research, finding the best diagnostic methods and best treatments. Just to kind of give you a rundown, evidence-based medicine comprises of three aspects. One is patient preference. So that is where the patient could differentiate which might be the better treatment for them based on cost and efficacy. Second
Okay.
is clinical experience. So there's tons of treatments out there, but I might be better at doing one treatment versus another, or I might have more experience with a certain modality versus another. But the most important part, the third aspect, is best available research and evidence. And that's really what makes evidence based medicine what it is. It's looking at the studies, really diving deep into the systematic reviews, randomized clinical controlled trials, and implementing them into our practice.
That is interesting. So, uh, cost and efficiency, and based on the person's or the patient's requirements, and their you can say condition. I mean, how exactly? I mean, do you assess what kind of physical history they have had, or what kind of special or personalized pain they're having? I mean, the concentrated areas. How do you assess that?
Yep, great question. So, for instance, there's a few modalities like shockwave, which have been FDA approved for cartilage activation, and they have great responses in terms of outcome measures. However, shockwave is pretty painful. I don't know if you ever received shockwave, but it is pretty painful, even though it does work really well. And certain patients might have a much lower threshold to pain, and shockwave might not be the best approach suited for them. So that is what I mean by patient preference, where a patient could choose and what is best for them based on, like you said, past medical history, just personal experience. They might have had a bad experience with the treatment. Some patients don't like using ice because they're super sensitive to cold. So I think we have to kind of make sure that we're understanding what the patient wants, and that will lead to better outcomes because they will be more compliant with that, whatever treatment plan we give them. That's another thing that you see in chiropractic today is it's kind of a one shoe fits all approach. Um, and yeah, so
No, that is really really empowering in a way, because it's for the people, not just simply enforcing anything on them. And I think that is the essence of functional and holistic wellness. And it's not like just suppressing the symptoms and masking it in form of curing it from the root. And also, Dr. Brian, I want to understand, as you mentioned about psychology and chiropractic. Psychology is now gaining importance. What do you think, what are the reasons that there are so many misconceptions running around chiropractic? I mean, is it because of how it is portrayed in the specifically on social media, or around the layman discussions, or is it something else that we are not able to identify?
yeah. So I think it's all of those reasons that you just mentioned. I think social media does a lot more harm than good. I think social media is a great tool. However, the thing that drives views, the thing that drives followers is the shock value. So if I say,
Mm.
hey, chiropractic really works and just leave it as that, I'm not going to get that many followers or views. But if I say chiropractic kills a bunch of people per year, which it doesn't, I think that's going to really drive the views up. And unfortunately, people use this to their advantage. And shock and fear sells. You see this on the news today, where pretty much all the news is bad, and you don't really see that much good on the news. That doesn't mean that there's not good out there. Shock and fear sells, um, and I think a large part of this, or I guess an argument that a lot of these social media influencers use is that chiropractors don't go to medical school, therefore they're not doctors, right? And that couldn't be farther from the truth. So no, we don't go to medical school, but is having an MD, does having an MD make you a doctor? Is that the only thing that makes you a doctor? In my opinion, it doesn't. So we have to address what makes a person a doctor. Is it someone that's able to diagnose and treat? Is it someone that's able to prescribe medicine? Is it person able to do surgery? Well, all those things I just mentioned podiatrists could do. Podiatrists could do surgery, could prescribe medicine, diagnose and treat, and they don't go to medical school either. And there's a few other categories like dentists, and a few others that I could probably name at another time. But just having that MD degree, it gives somewhat of an appeal to authority fallacy, where I have an MD degree, so I have a better, or I'm more superior to a chiropractor. And once again, this is far from the truth. There's even MDs who get away with a lot of things like overprescribing pain medication, overusing surgeries or other methods that aren't suited for the patient, the best suited for that patient. And I think this is where a lot of these influencers use kind of as their premise for their argument is they're not doctors, they don't have MDs, but I think I've illustrated that that's not necessarily true.
That proclaimed experts. But anyway, anyway, there's definitely a silver lining in the dark clouds, and I agree with you. I agree with you, Dr. Brian. So moving on, um, let's try to understand addressing prevention, not just the crisis. Although in terms of business, that will be kind of counterintuitive, but as you know, we all have always learned for since our childhood that prevention is better than cure. So many people only turn to chiropractic care after a major issue flares up. Injury or herniated disc, chronic headaches. From your perspective, Dr. Brian, how can evidence-based chiropractic um, practice play a preventive role even before people get to that crisis point?
Understood. So, yeah, I think I understand your question here. I'm going to try to answer as best I can. So, for instance, a
Mhm.
lot of the things that I hear are, oh, I woke up with this really bad neck pain. I must have slept wrong. Or I went to go pick up a pencil and I threw out my back, right? So, we'll use both of those examples. You've been sleeping this way your entire life. Why is it now, the day that you came in here, why is it that now you're sleeping the wrong way? Or was it really that pencil that you picked up? Was that heavy enough to cause you to throw out your back? Or are both issues kind of a result of a much more chronic issue that maybe you didn't even know you had symptoms for? And I think that's where evidence base comes into play. Because I could go and treat their symptoms. I could either adjust their neck, do massage on their neck, and they'll end up feeling a lot better. But if I'm not fixing the structural causes that cause that pain in the first place, then this is just going to happen. And they're going to have another night where they slept wrong or pick up another pencil that threw up their back in the future. So using evidence-based medicine such as X-ray, um, EMG, thermography, seeing what structures in the body are the true pain generators or dysfunctional, and treating those using the best available research methods in terms of treatment is how we really prevent these problems from happening in the first place.
Hmm. That makes sense. And is it something only required when you are aging, or it's age is not a factor in here playing an important role?
It's funny. We sometimes show patients our, I guess, textbook model of what a healthy spine is. And before we were using actual textbook images to show the correct X-ray um, presentation of a normal spine. And more recently, we started using older patients that have seen us for many years and have perfect spines, just to show that it's not age that defines the level of degeneration. It's how you're moving the body and how much activity you have and there's so many factors that come into a healthy spine. And age, although speeds up the processes of degradation and arthritis, there are things that you can do to prevent that, such as movement, proper nutrition, exercise. So age, although speeds up the process, it doesn't necessarily cause the process, if that makes sense.
Yeah, it does. Especially in today's times. Oh, okay, okay. Now let's talk about the solutions as well. But before that, I want to just bring in a different perspective here, for making it a bit of a nuanced discussion for our listeners also. Um, we know some people, that including parts of the medical community, they remain skeptical about the long-term effectiveness of chiropractic care. And you kind of touched down in the initial part of the conversation. I mean, they point to inconsistent research or a lack of large-scale studies. So, how do you address those concerns while still practicing evidence-based care?
I would just say do the research, and I'm not talking about going on Google and looking up articles on Google, but I think one quick search on PubMed, if you just look up spinal manipulative therapy or SMT, you'll find hundreds, if not thousands, of studies done on chiropractic. So the stigma, right? The thing that you just mentioned, lack of long-standing studies. There's actually, I would say, a plethora of long-standing studies on chiropractic. This has been around for over 100 years, and adjustments have been around for thousands of years. Um, so there is an abundance of research on long-standing effects of chiropractic. However, that doesn't mean that every chiropractor is the same. Like I said, we are in this kind of paradigm shift where these older chiropractors that were way in the infancy of chiropractic being taught philosophies and theories are kind of, for lack of a better word, dying out. And now the new, more evidence-based, science-based approach chiropractors are coming in. Um, and that's going to probably increase these studies and lead to better studies in the future. But I think right now there's enough research to say that chiropractic definitely works.
Hmm. And is it like, once you go to a chiropractic session, and like we do see in the videos, and I sometimes wonder, is it like a one time session? I mean, once you get to hear all those cracking sounds and everything is healed automatically?
So there are some chiropractors that don't, that cracking sound that you're referring to is from an adjustment. All that is gas escaping the joint, and we could go into exactly how an adjustment works. But there's some chiropractors that don't even adjust, and I think that's another misconceived idea, is that chiropractors just adjust, and once again, couldn't be farther from the truth. We do, all types of physical therapy and physiotherapy modalities. We do rehabilitation, massage, different exercise programs and stretches in the facility, decompression of the spine, either mechanical or manual, so much more. Um, that didn't directly answer your question, but um, so yeah, sometimes we will get an immediate release or relief of symptoms, and that's great. We love having that happen. But like I said, that's just treating the symptoms. The actual structural causes of those symptoms do take time to treat, and it's really on the patient and giving them homework and making sure that they're compliant in their exercise and stretching programs, that we really see the best outcome. So, although it's great to see those videos, I love hearing the cracking sound. Some would say I'm addicted to the cracking sound, um, but it is much more complex than that, and we do a lot more than just adjust patients.
Absolutely, absolutely. And I think chiropractic treatment isn't a magic trick. It is evolving. It is definitely an alternative approach. Holistically speaking, what I believe, rooted in restoring balance and alignment. Not only in your spine or backbone or in joints. But are there any important caveats to remember? Let's say, any cautions to take before even approaching chiropractic as a chiropractic treatment.
Yep. So I guess that's kind of a two-part question. So if you are a patient looking for a chiropractor, um, number one, you want to see what they do. You want to go in there, get a kind of idea of what they do before getting treated. And you could do that just by saying, "Hey, I would like to shadow, see exactly how you treat patients." And right from the bat, you can kind of understand what type of chiropractor they are. If they're adjusting patients the same way every single patient, you already know that's not the chiropractor for you. If they're starting to talk about this idea of aligning your spine and getting the correct curvatures of your spine, in place, that's also not the correct chiropractic view, just because those two concepts, that one shoe fits all treatment approach and this idea of spinal alignment structurally causing better outcome measures is just not evidence based. I would look for somebody that prides himself on evidence-based medicine, someone that does way more than just adjust. And you can look at their website, see what type of modalities they offer, see what type of services they offer. Do they have rehabilitation care? Do they have PTs working for them, LMTs working for them? Something that's way more, I guess, a one store approach, like a one shop approach, um, so that you know you're not just getting adjusted, as I just kind of mentioned, which chiropractors should not do as their sole treatment. And then also going apart from that, from chiropractors, we need to evaluate the patient, right? We need to make sure that the patient is safe to treat. And that's another kind of stigma that chiropractors get along the sides of vertebral artery dissections or strokes. And that's really been another social media influencer kind of fuel to their fire, saying that chiropractors cause stroke. And once again, this couldn't be farther from the truth. Actually, um, the incidence level and prevalence rate of strokes in the cervical artery or cervical artery dissection in chiropractic care is about the same as general medicine. So, how does that make sense? How does a regular PCP general practitioner have the same incidence of cervical artery strokes as somebody that's adjusting the spine? Well, because there's no correlation of a cervical adjustment and stroke. The reason why chiropractors have strokes to begin with is because patients already have a prevalence of strokes in the general population. I'm going to have a patient that will eventually have a stroke, but it's not due to the chiropractic manipulation. It's just due to the overall prevalence rate of cervical artery dissections in the population. So I just want to throw that out there. But we still need to do our job in evaluating, making sure a person doesn't have a past medical history of things of connective tissue disorder, such as Ehlers-Danlos, making sure that they don't have high blood pressure before receiving treatment, and a few other past medical history and family history evaluation questions that we have to rule in or rule out. I ask all my patients a series of questions. Sometimes I ask them to exhaustion, but it's done so that we make sure that the patient is in the safest possibility before getting treated.
Definitely. And I absolutely appreciate your transparency because acknowledging both the strengths and also the evolving signs, it empowers the patients to make better informed choices,
Mhm.
rather than just, as I mentioned, enforcing something on them to take sides. So that definitely is a mindful approach to this. And so before we wrap up, Dr. Brian, for someone listening right now who thinks, I feel fine, I don't need chiropractic care, what are some subtle signs or symptoms that might actually indicate nervous system imbalances they may not be aware of?
Yep. So the major red flag for nervous system imbalances that they might not be aware of would be fatigue, right? And I'm not just saying that you're tired, but um, like muscle fatigue, like you're not able to walk as far as you used to. You're not able to walk up as many stairs before getting out of breath as you used to. You're kind of craving sugar because your body needs that energy, and this could be a muscle dysfunction due to a nerve impingement that might not show painful symptoms yet. Going further than that, though, if you are experiencing pain, ask yourself, did I have any trauma to cause this pain? And I'm not talking about that pencil that you're lifting off the ground or that bad sleep position. Was there any true trauma to cause that pain? How long has this pain lasted? And if it's a chronic pain with no trauma associated to that, then we could kind of say with almost absolute certainty that there's definitely some nervous system or mechanical dysfunction going on that's causing that pain. And it's not so much let me just stretch my muscle and hopefully it gets better. It's going to probably take a little bit more time to really evaluate what's going on.
Thank you. Thank you so much, Dr. Brian, for sharing that. And that's really, really eye opening because many of us I'll be very honest, including myself. We normalize things like fatigue or poor sleep or brain fog. It's like we overwork and we feel like if we are lacking sleep or we are having back pain. Oh my goodness, I've done so much work that I'm feeling this. That means I'm working hard. But we don't realize our nervous system may be quietly asking for attention. So it's
Mhm.
really, really important to address these symptoms.
Yep, absolutely.
Wonderful. So, Dr. Brian, if our listeners they would like to connect with you and get access to the wonderful resources you are providing, what would be the best way?
Yep. So we are located in Brooklyn, New York. Our address is 9408 Fourth Avenue, Brooklyn, New York. Our website is mybrooklynchiropractor.com, and you could feel free to contact us there. We have our email and phone number at your disposal, and you could check out all our different resources. And we have even a blog posting page where we upload all different types of research, kind of illustrating some of the points I talked about today.
Wonderful, wonderful. I'll make sure to have all the links in the show notes. And listeners, if there's one thing I'm taking away from today's conversation, it's this: real wellness isn't about chasing pain, it's about listening to your body, being that much mindful that you can listen to your body long before the pain even starts. So, with that, what Dr. Donovan has shared today really reminds us that personalized, science backed, evidence backed care is not about creating or suppressing or just consuming fear or crisis. It is about understanding how everything from your nervous system to your lifestyle plays a role in how you feel every single day. So, thank you so much, Dr. Brian, for your insights and for showing us what truly mindful, individualized care is all about.
Thank you.
So, to all the beautiful listeners out there, may you continue to stay curious, stay present, and honor your body's wisdom. Until next time on The Mindful Living, take care of yourself and your loved ones. And to connect with Dr. Brian, just refer to the show notes along with this episode on your favorite podcast platform. Until then, this is your host, Sana, signing off. Thank you.